How does Romosozumab build bone for osteoporosis treatment? Imagine a medication that can both help your bones grow stronger and slow down their breakdown at the same time. That's what Romosozumab does for people with osteoporosis, a condition where bones become fragile and more likely to break. To understand how it works, let's first look at how bones normally stay healthy. Bones are constantly being remodeled through a balance between two types of cells, osteoclasts and osteoblasts. Osteoclasts break down old or damaged bone, while osteoblasts build new bone. In osteoporosis, this balance shifts so that more bone is lost than is replaced, leading to weaker bones. Romosozumab targets a protein called sclerostin, which is produced by bone cells known as osteocytes. Sclerostin acts like a brake on bone formation. It binds to receptors on osteoblasts, the cells responsible for building new bone, and blocks a signaling pathway called the Wnt beta-catenin pathway. When this pathway is blocked, osteoblasts become less active, and less new bone is made. Sclerostin also indirectly encourages bone loss by increasing the production of RANKL, a molecule that stimulates osteoclasts, the cells that break down bone. The key to Romosozumab's action is that it is a monoclonal antibody, a specially designed protein that binds specifically to sclerostin. When Romosozumab binds to sclerostin, it prevents sclerostin from inhibiting the Wnt beta-catenin pathway. This means the pathway can become active again, leading to increased survival, growth, and activity of osteoblasts. As a result, more new bone is formed. At the same time, because sclerostin's effect is blocked, the production of RANKL decreases, leading to less stimulation of osteoclasts and less bone breakdown. This dual effect, stimulating bone formation and reducing bone resorption, is unique among osteoporosis treatments. Most other drugs either slow down bone loss or promote bone growth separately. Clinical studies have shown that Romosozumab can significantly increase bone mineral density in the spine and hips within about a year. It also helps lower the risk of fractures, especially in postmenopausal women at high risk. Romosozumab is administered as a monthly injection under the skin. It usually takes around 3 months for the medication to reach steady levels in the body. Because of how it works, treatment is generally limited to 1 year. After that, patients often switch to other osteoporosis medications to maintain the improvements in bone density. It's important to remember that, like all medications, Romosozumab has potential risks. Some studies suggest it may increase the risk of heart attack, stroke, or other cardiovascular events in certain individuals. For this reason, it is not recommended for people who have recently experienced a heart attack or stroke. Doctors carefully weigh the benefits and risks for each patient before prescribing it. In summary, Romosozumab helps build bone by blocking sclerostin, which normally inhibits bone formation. This unlocks the bone-building potential of osteoblasts and reduces bone breakdown by lowering RANKL levels. This dual action makes it a promising option for people at high risk of fractures. However, treatment decisions should always be made in consultation with a healthcare professional, considering each person's unique health situation and risks. Always seek personalized medical advice to determine the best approach for managing osteoporosis.